Hi, and welcome to episode 45 of Empathic Action. Today I'm joined by members of Helping Hands. I learned about this group through the McGill Alumni News, and I was just excited to speak to them because I think they're just a beautiful example of empathic action. So welcome Noemi, Dylan, and Faizan, I should say. It's so great to have you. I know you're just three members of a bigger group. Helping Hands are med school students doing some great work out in the community. What do you do? What is Helping Hands?
So, hello. So Helping Hands is basically an organization that was started by two medical students when they noticed that female patients that they worked with early on in their medical education would put their families before themselves. For example, they would buy basic necessities for the children, but wouldn't have enough money left over for buying their own medication or buying their own hygiene kits. So the two medical students who founded this organization thought, how can we help? And they decided to make these kits. So they make these kits that contain 10 items, and they're basically personalized to each organization that we help. So Helping Hands currently on a regular basis helps three organizations. The Chronic Viral Illness Services at the Royal Victoria Hospital, which is actually where everything began. We also help CLSD Park Extension and the Native Women's Shelter of Montreal.
Fantastic. I can only imagine how the need for your kits has just become even more relevant under COVID, right? Are you seeing a change?
So actually, the kits are not necessarily more needed at the time. But what we did was that we emailed more shelters than we usually help because we wanted to know how women's shelters and organizations were affected in Montreal at the time of this pandemic. And what the shelters said was that they needed more money rather than items because they had their needs had expanded with the pandemic. So first they need to buy fresh food now that many of their suppliers are not able to supply them with food. So for example, some organizations that were making little baskets of food for families, now they're not able to do that with fresh food anymore. So they would like money to be able to give fresh food to the families. They would like to be able to buy the self-sanitary products like hand sanitizer and masks and stuff like that. And that costs money that was not like in their budget before. And other people need like plenty of stuff, so we decided to give money rather than giving normal kits like we usually do, and that was all based on what the shelters said they needed. And there's also the fact that homeless women are more at risk than ever right now because first they're more at risk than everyone of having to go through food insecurity and also of contracting the disease. So they are more in need than ever of the shelters and the organizations in Montreal, and the shelters and organizations are in need of our help.
So I'm hearing that McGill med students care about like social justice issues and community health. That's fantastic. So anybody who's watching who feels like stepping up, how can they help?
Yeah, so as Naomi said, the needs of the different shelters are very diverse. And so right now we have our fundraiser, which is still going on. So if anyone's able to donate, we know it's difficult times right now. They're welcome to go visit our GoFundMe page and they can donate there. And if not, the other thing that we're trying to promote is more awareness to the general public about the ongoing issues. So just sharing the page or sharing their thoughts on what's going on for women and their health.
How much money have you raised so far, and how much money do you want to raise?
So far, our original target was $800. As of a few days ago, we raised about $8,000, so about 10 times our target. So we're just trying to continue building with the momentum that we've had and continue with the growth.
So I'm going to include information in this video about how to get to your GoFundMe campaign. And if anybody watches it after the campaign is concluded, they can reach out to your organization and support you in other ways going forward. I just want to say that on behalf of, the community, wherever you're going to be serving as doctors, we now know more than ever the crucial, vital role that everybody in the healthcare profession plays. So thank you for being part of that pipeline. Good luck, good health to you. Thank you so much for joining. It was great to speak to you. And thanks for joining. See you tomorrow. Have a great day.